As the sort of scientific voice on our panel here this evening, do you feel that compliance may have been undermined by the events of the last few days?
Well, it's interesting, isn't it? Because it's not exactly about what Dominic Cummings did or he didn't do. The question is really about what is the impact of that. And what we've heard from our members, who are CEOs of hospitals, of GPs, all across the health system, people are worried that public health messages are being undermined. They're already hearing that people are making decisions they might not have otherwise made. And that's really worrying, because in order for these public measures, whether lockdown, test, track and trace, any of these things to work, we need to have a really clear message that isn't open to too much interpretation and discretion. And we need to have this public feeling that we're all in it together. And I think that for those reasons, one of the hospital CEOs said to us recently that this could actually be one of the biggest risks to public health since lockdown began. So I think that all of these are key considerations as we think about what next.
Alison, can I come back to you? Has it had any impact on whether you will be more or less compliant as we're going into test, track and or test and protect or test and isolate now? Layla?
Well, it sounds as though we're getting there with the human contact tracers as has been discussed. Clearly, it's only just launched. There are going to be operational issues as it starts to bed in.
Well, hang on. We were told it was going to be world-beating on Monday by the Prime Minister.
Well, I don't think that anyone in the NHS needs it to be world-beating so much as just really, really effective. And that's what we're hoping for. At the moment, it's just kicked off. We don't yet know what it's going to be like, but we are strongly hoping that this is going to be a really effective way of working. The app question is interesting because, of course, we were promised that the app would be here as part of that system. And in some ways, we don't need to be really distressed that it's not there on day one, because it's only part of the system. It's not the main part of the system. It's an adjunct. It will be something that will improve our ability to find people who are at risk and make sure that they're able to quarantine and be safe. But I think that this is really more of a challenge that we keep on being promised that things are going to be here and then they're not. And it's part of what I was saying before about just eroding people's confidence. The NHS has had lots of disappointments where they've been promised PPE coming on a plane from Turkey and then it hasn't come, or they've been promised PPE that was going to work and then suddenly it's substandard in some way. There's lots of expectations that are raised and then they're dashed. And I think that what we're hearing from health leaders is promise things that you're able to deliver when you're able to deliver them, and that will really help to build staff confidence and help to build patient confidence.
OK. Eleanor, you wanted to come in.
Yes, just picking up on that last...
admitted people from hospitals back into care homes. But in some cases, in some countries, they put them into quarantine, special places or quarantine within care homes. Is there anything we could have learned from that reasonably, or is Alex right that actually, this was the best we could have done in the circumstances?
It's incredibly hard to say. I look at all what other countries have done, and as you say, there's been some sort of quarantine centres or interim places to go. It's not exactly clear. I mean, obviously, what has happened with COVID-19 in care homes has been an absolute tragedy. But the reasons for that are not quite as clear-cut as sometimes people are assuming. So we hear people say, oh, it's because everyone was sent out of hospital. But actually, when you look at the data, it's not totally clear that that was something that has created this challenge. And in fact...
Or you think it might have spread in care homes anyway?
Well, that's the thing. I mean, at the end of the day, we don't know when this first started circulating. It looks as though when you started testing has a real impact on this, looking at other countries and care homes. It looks like people going in and out of care homes, potentially, of course, playing its role. And while we really, really want an answer to that, it's too early to figure out what's going on, but we can see that we need an answer and we need to learn. And I guess that what I'd say is that it really exposes the underinvestment and the undervaluing of social care for successive governments. And what we really need here is a bit of a long-term plan. We've seen what's going on in social care, and it's really great that the government is now giving some money towards social care to say, goodness, we need to bolster, for example, your infection control mechanisms. Our members have been telling us for ages that while hospitals have started to get PPE in, care homes have been in a much worse position for that. There's a lot of disparity here. So there's now funding so that care homes are able to get better infection control processes in place and things like that. But that's a short-term fix. And when we look at this, we think, goodness, the moment is here for social care reform. And what are we going to do about it? What's the government going to do about it?
Ian?
Well, I think the chronic underfunding of social care across the United Kingdom and in Scotland, the chicken